My name is Tana McKeel. I have chosen to use PowerPoint on cancer death rates in Native Americans due to environmental factors. I am half Ojibwe and a member of a First Nation tribe, so I definitely felt pulled to explore potential causes of our cancer mortality rates. Native Americans are over twice as likely to die from stomach cancer than their white counterparts, as well as just under twice as likely to die from liver and IBD cancers. For every 100 lung cancers diagnosed, there were 6 more deaths among natives than among white people. These death rates have been declining in native men since 1997, but for native women, the rates of lung cancer continue to increase. This is a problem for natives on and off reservations, but the northern plains and Alaska natives are being hit the hardest by lung cancer deaths. There are approximately 5.2 million Native Americans. They are separated into 573 federally recognized tribes, more than 100 state recognized tribes, and tribes recognized by neither. There are vast cultural differences between all tribes because they are independent nations. But according to Wiggins et al., there were no obvious regional differences in cancer incidence rates among Native populations from the national data. In addition, Emerson et al. Published a 2017 study for natives in urban settings, and despite equal access to preventative and cancer care, natives still had a higher mortality with some cancers, and more patients had multiple comorbid conditions. Canada's First Nation adults had a worse survival rate for most cancers compared to non Aboriginals, according to a 2016 publication in the American Association for Cancer Research. So, what are the leading environmental causes that result in cancer mortality for Native Americans? According to a 2014 study, tobacco use is the number one preventable contributor to lung cancer and various other cancer for natives. It becomes complicated for natives, though, since tobacco is culturally and religiously significant. According to the CDC's website, around 20% of both native men and women over 18 smoke. Additionally, Byers conducted a study in relation to Native American nutrition and found that nutrition-related cancers are likely to rise due to the diet changes among natives. Lastly, a 2009 cohort study published in the American Journal of Epidemiology found a potential synergism between native miners exposed to radon who also smoked. According to the study, the apparent interaction between radon and smoking in causing lung cancer remains submultiplicative but greater than additive. The most obvious impact this issue has on Native Americans is the loss of life. In Native American culture, your life is not truly your own. Instead, every person is an important piece of the tribe. As natives continue to smoke and consume diets that are byproducts of their colonization, they will continue to be at risk for cancer death and subsequently forcing their tribe into mourning. In Native folklore, we were told tobacco was given to us as a prayer vessel to the Gitche Manitui, but it seems to only be another thing hurting Indigenous people. Since tobacco is still deeply rooted and sacred in Native culture, completely eliminating it is out of the question. Having said this, in 2008, Bliss et al. Did suggest that culturally appropriate tobacco prevention, control policies, and resources are a potential solution. The keyword here is culturally appropriate, which means listening to the tribes and hearing what tobacco means to them, as well as implementing ways to minimize its health impacts. SBL made the recommendation to prevent secondhand smoke by implementing smoke-free environments in casinos and gambling parlors. They additionally advise that involving the community by using various drinks will increase the sustainability of success outcomes. Changes in diet are important to prevent nutrition-related cancers, according to Byers' 1996 study, which could easily translate to the promotion of traditional food versus colonized food. Finally, Indian Health Services promises to improve surveillance, screening, provider training, and public health research.